What's up, guys? Welcome to another episode of the Fresh RN podcast. I'm Kati Kleber, and we're going to continue our communication tips series. So this week, we're going to chat about communication tips for talking to patients and their loved ones, support systems, all that jazz. I've learned a few things over the last 11 years in working with patients. There's very tiny things that we can do throughout a shift that really decrease their anxiety and increase their trust. When we do that, they unclench and they can trust us more and allow us to just do our job. Give us that space to get things done for their loved one in a timely manner. They believe what we say and are on board. And I think that's really important to facilitate a good relationship with them, because it's very difficult to take good care of somebody when you're constantly being questioned, when you constantly have to explain every little thing, when one explanation isn't enough, and then they're very hyper vigilant and questioning everybody who comes into the room and their intentions. So let's talk about how we can facilitate an environment that's trusting and supportive. One of the things I think is really important is predictability. This is especially important in the ICU setting or the emergency department setting, where things are scary and things are changing so quickly. Any degree of predictability, even if it's small, is something that can decrease anxiety. So what does this look like? When you go in the room, you tell them, hey, maybe you're going for the beginning of the shift. All right, I'm going to come in. We're going to do some meds and assessment, talk about the plan for the day, kind of get you situated in bed and answer any questions you have. Follow through with that before you leave. All right, is there anything else I can get for you guys? And then you say, all right, so I'm going to go see my other patient and kind of do the same thing with them. And then I'm going to check on you guys when I'm done, hopefully in about 30 or 45 minutes. And then basically that kind of means whenever you go in the room, tell them what you're about to do. And what they can expect, maybe in the next hour or between the times that you're going to see them again. So, if I was going in at the beginning of the shift and I said what I already said, and I know, okay, we got a CT today. They've got to have labs drawn at noon. I'm going to hang some vanc later. I'm going to titrate these drips. I'm going to try to get rid of one of the drips. Those kind of things. Or we know physical therapies come in. I want to tell them that. Like, okay, we've got a CT scan scheduled today. It's supposed to be about 24 hours after you had your TPA yesterday. So that looks like it'll probably be around 1 or so. So whenever the CT scan department calls me, I'll let you know when we have a time when we're going to go down and get that scan. I also need to draw labs a little bit later. We'll also do some antibiotics in your IV at a different time, at whatever time it is, so they can know, okay, this is what's going to go on today. It gives them some semblance of control and predictability and okay, I know that these things are going to happen. It's not like they're sitting in there just waiting for someone else to come in at any moment. They can kind of okay, I know that these people are going to come at these times. And if people come in the middle, it's not as disruptive as constant unpredictability of who's going to be in the room next. Okay, great. Physical therapy was just here 10 minutes ago, and now lab is here, and then the physician's going to come in, and you want to provide any predictability that you can, even if it's as small as the next time you're going to be in the room or the CNA is going to be in the room. And as much as I hate whiteboards, they do make sense with this. If you can put on the whiteboard your name, maybe when the next pain pill is due, if you're having trouble controlling pain, whatever concerns or any predictability aspects that you can put on there is helpful. Now, the caveat with whiteboards is when you're so drowning in basic patient care, the whiteboard's the last thing you care about, right? I get that. I absolutely get that. But it does make sense from a patient standpoint to chill them out a little bit, and their loved one, especially if you can tell if it's a hypervigilant loved one. That can just really save you a headache later. So consider doing that. As much as we hate the whiteboard, it can serve. I will relent. It can serve some purpose. Also, another thing at the beginning of the shift, when you start off that at the beginning of the shift, that can make such a big difference. So instead of being that like meek and like, hey, I'm Katie, I'm here to take care of your loved one. Okay, let me know if you need anything. Bye. If you have any questions, okay, bye. Like, please don't talk to me. What if we came in with just a little bit of confidence, not an air of confidence, but just a little bit to the point where you just kind of feel comfortable with yourself and feel comfortable in your own skin and in your own role. Hi, I'm Katie. I'm one of your father's nurse today. This is what we're going to do today. It looks like we've got an order for this and this. The goals are going to be to get rid of these drips. Maybe sit up and get a speech evaluation, see if we can eat, or, whatever the goals happen to be that you know of, that you got in report that, hey, we're going to try to get them extubated and we're going to try to get rid of the levo. Like, translate that to them so they understand what we're working towards. That can really, really make a difference. And again, unclench. While you don't have like time frames necessarily for when the vent might be weaned off or when the levo might come off, it's giving them like, oh, that's what we're going to try to do today. And that, again, helps people unclench. And that confidence, that not arrogant confidence, but kind of a humble confidence, helps people feel safe with you, okay? It helps people trust that you know what you're doing. And even if you're still learning and figuring it out, you can still have that. You can still have that ability to come into a room. I'm Katie, I'm on orientation. Mike is the nurse that's with me. We're going to be working together to take care of your dad. I will be with you all day. I want you to know you're in great hands. Mike is a wonderful nurse, and I'm really excited to learn from him, and we're going to be working together. Like, just communicating like that instead of like, hi, I'm Katie, I'm a newer nurse, and I'm working with Mike today. Okay. Like, the way that you can portray yourself is so different with both of those. So I just encourage kind of trying to step into that, and because it really can benefit your patients. Next, I want you to build trust early. So you can do this with something small, even like can I get you anything? And then actually going to get the thing and bringing it back. I have an example of one I did, and I may have mentioned this before in the podcast, but one time I came in and I had a patient. She had come in over the weekend with a stroke and had, failed the swallow avail from the nursing staff. So she had to be evaluated by speech, but she wasn't like this big emergency in it. She came in at a weird time where she went like a day or so. I can't remember exactly how long it was, but it was too long for the family member his comfort because she hadn't had anything to eat. It really worried him that she hasn't had anything to eat. And she really was that borderline person of, is she silently aspirating? We don't know. I can't tell. So, I came in, I think I was Monday day shift, and he was irate that she had not had anything to eat. And I was told this before going into the room. So what I did was I kind of leaned into that right away. And I said, hey, Mr. Smith, I don't remember what his name was. I hear that your wife, she didn't pass that swallow eval. We haven't been able to get her anything to eat safely. And I know that getting her something to eat is really important to you. So I want to let you know what I'm going to do. Speech therapy arrives at 8 a.m. And right now, I think at that time it was 7 a.m., right? Because the report was at 7. And I said to him, as soon as they answer their phones, as they're able to answer their phone, I'm going to call them and I'm going to see if we can get your wife to be seen first and get this taken care of so that they can evaluate her swallowing, see if it's safe. And if it is, get her something that is safe to eat right away. How does that sound? And you could just see kind of the tension, just kind of okay. This person hears that I am upset about something. There is a plan to address it. And he was still upset, but he was still controlled upset instead of I'm so upset I don't know what to do with myself, right? We kind of went down a level, which was what we needed, right? So, and I did just that. I called speech right when they opened and said, hey, I just want to let you know about this situation. Let them know, hey, I think that the sooner we can see this guy or this patient will be really good for everybody. And they were very understanding and were helpful because they also don't want to go into the room and have someone irate at them, right? Like we're kind of working together to address this situation. So once I talked to them at 8, they said, okay, we're going to do our chart review. I'm going to just make sure there isn't any emergencies and I will be there by 8:30 or something like that. So as soon as I talked to them, I went into the room and let them know, hey, talk to speech therapy. That's me following through with what I said I was going to do. Like that's what they want to see. So I just want to let you know, talk to speech therapy. She is looking at her chart right now. She's just going to make sure there isn't an emergency going on somewhere else, get prepared, and then she'll be up here. How does that sound? And he was just like, thank you. And the rest of the day, I think she had pretty like straightforward care, like post-stroke, wasn't anything crazy. And he was just so complimentary and so kind. It was just like, so glad that someone heard his concern and that got it taken care of. And it was something small. Like I called speech therapy at 8 a.m. It wasn't that, wasn't very heroic, but to that guy, that was the most important thing in the world. The patient was, the patient, she was, I don't know if it was as nearly as important to him, but like those little things can make such a big difference. So if you can follow through with those kinds of things, or even like small, like, oh, can I get you a warm blanket? Oh, we don't have any, but I'm going to put some in there and in a little bit, I'm going to let them get toasty for you. I'm going to bring one back. And then when they see that you follow through, that you're true to your word, they trust you more, they chill more, they relax more, which is what you need. Okay. Next, you really want to build that team mentality. I think people come into the hospital and think that it is patient and family versus the hospital staff, and we're at odds with each other and like fighting to get out of the hospital and be okay. And it's kind of adversarial. Like they feel like they have to advocate constantly to you, and it's a tough place to be. And it's a hard place, I think, for us to make a trusting therapeutic connection. Oh boy, I just sounded like a nursing textbook, didn't I? Wow. Oh boy. But I think that's true. Like it's hard to really collaborate with them if we're at odds with one another. So anything that we can do to dissipate the us versus them mentality is really important. It'll turn like conflict into collaboration, and I think that's really important. It'll make your job easier if you're not having that hypervigilant person constantly questioning you. So little things that we can do is, are there any concerns that you have? How can I work with you, and how can we address that? What kinds of questions do you have? How can I answer those? I have an example of a time this happened with me. I had a patient who did not want to go to a nursing home. Understandably so. But he was very weak, and he also had a lot of antibiotics for a very, very serious infection. Like, you need these antibiotics to survive, and if you don't go through this, this infection is going to be very, very, probably going to be terminal. So I, and the way it kind of happened was kind of sad, where how this medical team comes in and says, okay, you need to go to the nursing home. And he's like, no, like he was very, I'm not doing that. And it was very us versus them. One of the physicians, I wasn't in there, I was in with another patient, and one of the physicians came to me and was like, so he's refusing to go to the nursing home, oh, he's not doing what we want him to, kind of thing. So I was like, let me get a few minutes with the guy. And so I let him chill out, and then I came in a few minutes later and was like, hey, tell me what happened. What's going on? I let him tell me his version of the story. And I was like, okay, so tell me why going there is a no-go for you. And I let him tell me why he's nervous and doesn't want to go. And I was like, I hear you. I so hear you. I would not want to do that either. I do want you to understand, though, what you might be facing if you make this decision, and how it might actually make things overall harder. Where if you could go to the nursing home now for a week or two and finish these antibiotics, you could probably go home. But if you just go home right now and you let this infection rage in you, you're going to come back to me and you're not going to leave. I need you to understand that before you make this decision. And I'm not trying to tell you have to do this. You have every you have the power to make this decision. This is the ball is completely in your court. I think you need to know what will happen either way. So he was like, okay, I just want to think about it. I just need some time. All right, cool. I'm here if you need questions. If you have any questions, I'm right here with you. I'm on your team. I want whatever's going to be the best decision. And it would not be right of me to not explain it so you fully understand the gravity of this situation. And he was like, okay. He took him an hour or two, and then he called me back in and he said, okay, I'll do it. I know I need to. I really appreciate you explaining that to me in that way. So sometimes if you can just give people like hey, I'm not trying to come down and tell you got to do all these things. I probably skipped a few steps here by telling you have to do this. I want to go back around and explain fully what's going on here, and that this truly is not just to punish you or something, but this is going to be like big picture, the best way, the fastest way to recovery, and not having to keep coming back to the hospital. So the way, if you can frame things like, we're on the same team here. I need to know what you want to do and what is important to you and how we can make that happen and work together. Boy, they hear that and it's like, okay, all right, I'll meet you part of the way. You are meeting me part of the way. And that's when you guys work together and get whatever needs to happen to go down. And that's the rewarding stuff. It really is. All right, let's talk about when you do get those kind of misunderstandings and issues where miscommunications, those happen all the time. Lost in translation, you're saying something and you think they understand, but they don't actually understand and don't really know what they were agreeing to. It kind of reminds me when my daughter, she's 5 right now, and I'll say, hey, do you want to do this? And she'll say yes, and then it'll be time to do it, and she'll go, oh, wait. I don't think I knew what I was saying yes to. Which I so appreciate that, oh wait, I didn't know what I was agreeing to. I think I was just trying to be agreeable. So backing up, okay, so here's what's going on. If someone seems angry or upset, I think the emotionally mature way to navigate that is to say something, is to lean in with curiosity. So let's not take it personally. Let's not avoid it because that's just going to make it worse. But lean in with curiosity. Hey, you seem upset. Can you tell me what's going on? I'm going to do what I can to help fix whatever's going on. And hear what they have to say. Maybe they are upset about something. They know it's outside of their control. They know there's nothing you can do about it. But just saying, hey, I'm really mad that I am not going to this test today because someone brought in food and I ate it, but I didn't know I couldn't eat. That's legit to be mad about. I get that. So, letting them have space to express feelings without judgment, without you absorbing them and taking them personally, and validating, acknowledging, doing what you can to make whatever you can right. Boy, that can make a big difference. So encourage you to lean into those with curiosity. Do not avoid them. Truly, most people just want their concerns to be heard and validated, not necessarily have this big, elaborate action plan of fixing it with something that's out of your control, right? So I encourage you to lean in with curiosity. So that concludes my tips for working with patients and their support systems. I hope that helps. If you really liked this kind of content and you're a newer nurse, one thing that I have, this ultimate resource, is called the New Nurse Masterclass. It's this nurse residency program that has a huge section on communication, among many other things, to help acclimate yourself to the hospital environment in an emotionally intelligent and confident yet humble way, where you can really acclimate into this new, very intimidating role with a lot of support. So that self-paced nurse residency program is called the New Nurse Masterclass, and you can go to freshrn.com/courses to check it out. And don't forget to sign up for my email list so you can get lots of weekly tips and tidbits and encouragement. All right, thanks guys. We will see you next week. I am going to chat about difficult conversations. Bye guys.